Hi there, and welcome to today's workshop all about pregnancy and nutrition. My name is Allie Tallman. I'm a registered dietitian, and I'm here to chat with you about how to optimize your health and your baby's health through food. As I mentioned, I'm a registered dietitian. I'm also the founder of the nutrition consulting company Nourish. So I'm going to start us off by chatting a little bit about my food philosophy for today. So as a dietitian, I've been a dietitian for 7 years. I got my master's degree in nutrition as well. I focus on the food philosophy of real whole foods. So I'm all about helping my clients to focus on real whole foods to optimize their health. So no crazy supplements, no crazy fad diets, no juice cleanses, things like that. Especially during pregnancy, it's so important to really use real whole foods to nourish and fuel your body. I'm also an evidence-based dietitian. So as I mentioned, I'm a master's degree in nutrition. I'm a research-backed dietitian. I don't want you wasting any time or energy or money on things that will not work for you. So therefore, I'm all research-backed because I want the things to work and to stick. I'm also a results-driven dietitian. You will have different results or different goals than the next person. So I want you to really focus on habits and lifestyle changes that will work for you, for your daily routine, for your dietary preferences, and so much more. But ultimately, all my clients see the results that they want. So I help women to optimize their health during pregnancy. I help them to manage symptoms and side effects that may occur, help them to increase strength and energy through food. And then I also help them to build consistent and stress-free eating habits. So we're going to jump right in here. So our talk today, we're going to talk all about what diet is recommended, nutrients to focus on, nutritional management of the side effects that can occur, hydration, nutrition and physical activity. And then lastly, stick around because I'm going to have a free resource to give everyone. And the free resource you can have instant access to, which I'm really excited to share with you. So if you're looking for really easy and quick nutritional changes to put into your routine, this is for you. These eating habits will make eating stress-free, or this free resource will make eating stress-free and less overwhelming, which I know many of you are busy and tired during pregnancy. So stick around for that. Lastly, I'll provide you with my contact info. So if you have any questions at all pertaining to this lecture about your pregnancy, etc., please email me. You can either have one question, a list of questions. I'm here to answer them. So please email me and introduce yourself and say hi. So starting us off with nutrition. So adequate nutrition is crucial for tissue formation, neurological development, and bone growth, and lots more for you and your baby. So a well-balanced, nourishing diet is very, very important. So as you can see here, we have the different trimesters. The first trimester is the development of the organs, limbs, facial features, placenta, so much more. Second trimester, continued growth of those. Third trimester is the time for intense growth. This is kind of like we're running to the finish line here. But as you can see here, each trimester is crucial during pregnancy. And therefore, your nutrition and eating habits should be nourishing as well. Some other factors to consider: preconception. So the mother needs to have a healthy diet and healthy, really overall nourishment to have a healthy uterus. Nutrition plays a role in fertility, and your nutrient stores are very important in order to supply a developing fetus. So preconception, very important. Postpartum, moms need to be healthy in order to support and care for their baby. So physical health, emotional health, mental health, everything. You need to make sure you're taking care of yourself postpartum in order to care for your baby. Nutrition also impacts your breast milk supply. Now, we won't go too much into this today. However, wanted to really chat a little bit about preconception and postpartum for you. For preconception as well, most women actually don't know that they're pregnant until 5 to 7 weeks gestation. So therefore, taking a prenatal vitamin is so, so important. So if you're watching this and you're not taking a prenatal yet, please start taking one ASAP. And I recommend taking a prenatal at least 3 months prior to trying to conceive in order to really optimize your nutrition. These are some things to look for in a prenatal. We're going to go into some of these today. However, if you're wondering, like, am I taking the right prenatal? Am I missing any nutrients? Please contact me using the email address at the end of this. I'm here to answer those questions for you, and I'll tell you if your prenatal is legit or not for you. EPA and DHA are omega-3s as an FYI, but we're going to go into some of these today. So looking at nutrition and pregnancy. So it's important to meet the mom's nutritional needs as well as the baby's. So instead of just one person, we're thinking of two people here. And it's important because deficiencies or nutrients in excess, which is nutrients toxicity, we call it, can lead to growth abnormalities or impairments. So for example, too little vitamin C can result in premature birth, whereas too much vitamin C, for example, can be toxic for you or the baby as well. So you want to make sure you're getting the right amount of nutrients. So the overall diet I recommend as a dietitian is focusing on real whole foods. So making sure that you're focusing on foods that will nourish your body and fuel your body. And that's why nutrient dense foods are important. Thinking of variety and balance. How can I get more color? How can I eat a little more variety into my daily routine? So this is what I do recommend in terms of what diet are whole grains, lean proteins, fruits, veggies, and healthy fats. We will go into this more in depth. One thing I will say, I know many of you for first trimester may not be feeling your best. You may be feeling pretty crappy. The thought of a veggie grosses you out. That is why a prenatal is so important, is to make sure you're getting some nutrition in you. But then when you feel your best or feel better, that's when getting this type of diet in is what I recommend. So nutrients of concern, protein. So protein helps with the growth of the fetal tissue and the uterine tissue, and it increases blood supply. You want to make sure you're having adequate blood supply to really give the baby what they need. Overall, you do want to aim for 1 to 1.2 grams of protein per kilogram of body weight. One thing to note though, is if you are physically active, which I know most of you are, you're going to need more than that. And that's really to help build up your muscle and to fuel your cells. You want to eat protein throughout the day and to start your day with protein. So you should be eating breakfast, and it should be a protein-rich breakfast. If you're thinking of like how much protein, like what does that mean? 1 ounce of meat is 7 grams. And here's a list of protein-rich resources here for you. So like turkey, chicken, fish, peanut butter, etc. And here is an example, especially if anyone here is bad at math and just needs to like see it out if you're a visual learner. 150-pound woman, we're going to say she's physically active, so she's going to need a little more protein. She's going to need about 102 grams of protein per day. Now, one thing to think about is 1 serving of meat or 1 ounce of meat is about 7 grams. Typically, 1 serving would be about 2 to 3 ounces of meat, so it'd be about 14 to 21 grams of protein. Next nutrient to think of is calcium. So calcium helps regulate your bodily fluids. It assists in the production of the baby's bones and tooth buds, which I know can be crazy to think about, that you're developing not only a baby, but a baby that's developing bones and tooth buds in there. It's recommended to consume 1,000 milligrams per day. You could think of it as milk, eggs, yogurt, cheese. There are some dairy-free resources of calcium if you keep dairy-free. And just as an example, so you know, 1 cup of milk has about 300 milligrams of calcium in it. So I threw the word pasteurized on there, and I know many people don't know what pasteurized means. So it's actually a process where you sterilize the food to make it safe. Now, there is a misconception that we can't be eating soft cheeses or things like that during pregnancy. You can eat those soft cheeses during pregnancy as long as they are pasteurized. In the US, most dairy is pasteurized. You really need to think about when you're traveling and you're elsewhere if the food is pasteurized or not, because pregnant women are more at risk of foodborne illness. So overall, to play it safe, you can focus on hard cheeses if you're unsure. When you're eating out, just ask the waiter. They should know. If they don't know, they'll tell you they don't know, and then get the hard cheese. And you can eat it, again, as long as it is pasteurized. Nutrients of concern, iron is the next one. So it helps increase that blood volume, and it decreases the chance of anemia. So as I mentioned before, your blood volume, very important thing to think about. So iron is crucial during pregnancy. It's another nutrient that you need in your prenatal. It's recommended to get about 27 milligrams per day. Here are some great sources. So as you can see here, Like lean meat, lean protein, such as turkey, chicken, or fish are great sources. So are whole grains, so are leafy greens. So you can be a vegetarian and still get enough iron. One thing to think about is a 3-ounce serving of meat has about 2 milligrams of iron in it. Next thing is folic acid. People have heard the term folate, I'm sure, in this group here. So folic acid is important, or folate, because it reduces the chance of neural tube defects. Folate is very common in fortified foods now, or found in foods, and folic acid is in fortified foods. So the way to think about it is folate is natural, it's in foods. Folic acid is the synthetic form, and it's in the fortified food options. So here are some sources to look for. Folic acid will be something that is in your prenatal vitamin though. So to recap that, folate is naturally occurring. Folic acid is in the synthetic form. It's crucial to have this. That's why having this before the first trimester, so starting a prenatal prior to conception, is crucial. And it's actually a huge reason why many women take a prenatal. And the main difference between a multivitamin and a prenatal is having that folic acid in it. So vitamin C is also crucial because it aids in wound healing and it helps with bone and tooth development. I know many of you likely know that it's in like oranges and citrusy foods. However, it's also in tomato, peppers, and potato. So foods to avoid during pregnancy. So we did bring up the unpasteurized foods. So thinking of your soft cheeses, for example, you can always ask, is it pasteurized? You want to be limiting or avoiding your raw or potentially contaminated seafood. So sushi, unfortunately, a lot of sushi out there you cannot eat. You can eat cooked sushi rolls though, or like tempura. So if you're trying to go out for a sushi night with your date or some girlfriends, you can definitely still eat sushi, but you have to eat the ones that's cooked. Undercooked food. So making sure you're not ordering like the raw steak when out. You should be eating food that is thoroughly cooked through, because all of this will reduce risk of foodborne illness. Oops, the wrong way. Okay. Foods to avoid during pregnancy as well. Unwashed fruits and veggies. Anytime you go to the grocery store, making sure that you wash your fruits and veggies is so, so important. Make sure you wash it before you put it in the fridge. That way you don't have to think about it. Excessive caffeine. You can drink like 2 cups of black coffee per day. You can't drink your extra large Starbucks 3 times a day, for example. You also should be limiting alcohol as well. So next, we're going to go into the common side effects and how to manage them nutritionally. So cravings, something that is really common during pregnancy, and they vary from person to person though. There's this myth out there that you're having a craving, it means that you're deficient in something. That is not true. There's no research that supports that. You're craving something just because all these different changes and hormone changes going on within your body. So lean into your cravings. Now is not the time to diet. Don't avoid the ice cream. Don't avoid, any of those specific foods. Lean into your cravings. And remember that you're growing a human inside you. Food aversions vary. So certain foods, sight of foods, smell of foods, time of day, they vary from person to person. So it's hard to say which one is which, but many people are adverse to coffee, tea, eggs, poultry. Just take note. I usually recommend like journaling things and do your best to avoid it until you can consume it again. Did you know? So 7 out of 10 women have morning sickness during the first trimester. And this is according to AmericanPregnancy.org. So it is really common, unfortunately, for you to feel morning sickness, but I'm here to give you some tips on how to manage it. So eating small meals often, drinking before and after meals, not during meals, eating plain crackers 15 to 20 minutes before getting out of bed in the morning, staying hydrated, so drinking lots of water. So if you have water near you, here's your reminder. Sipping on lemon or sucking on like ginger chews to relieve that nausea. You don't want to lie down right after a meal. You don't want to skip meals. You don't want to cook or eat spicy food. Spicy food can make you feel more nauseous, or like very fatty foods as well. So one myth that I wanted to bring up, as I said, when you're nourishing your body for two, however, you hear you're eating for two all the time. Unfortunately, you only need roughly 300 extra calories per day during the second and third trimester. So you're not needing to eat two separate meals for lunch, for example. So that is a myth that you will commonly hear. Another myth, gaining less weight will make delivery easier. And that is a myth, because not gaining enough weight puts the baby at risk, actually. It puts at risk of premature birth, which can cause heart and lung problems. Now, one thing to think about, I know all of you are active individuals. Individuals are clearly focused on your health. You're participating in this workshop, for example. You likely don't want to have a ton of weight gain. It's normal. It's natural. You don't feel like yourself. However, weight gain is normal, I will say. You want to check in with your physician for more individualized recommendations. However, anywhere between like 11 and 40-ish pounds is considered normal. It depends on where your baseline is at, and it's very different for everybody. So that's why I do recommend checking in with your physician to kind of see where you're at and to track those changes. So, reminder for you with that, pregnancy is not the time to diet or to try and lose that weight. Please do not diet while pregnant. You'll be putting yourself and the baby at risk. Weight gain in your body changes during pregnancy is normal, and it's actually a good thing. When you're gaining weight, you're growing a human inside you. Instead, focus on what's in your control, like the food you put into your body, the nourishment you put in, and what physical activity you choose to incorporate. You guys are all active. Like I said, I know you're active, so you are doing a lot of the right things. Another potential side effect is constipation. Some ways to navigate that is making sure that you are adequately hydrating your body. Aim for at least 64 ounces per day. Another reminder. If you are allowed to move, so you're not on like bed rest or anything, go for walks, get your movement in, do this program, keep moving your body as much as you can and in a safe way. The next thing is consuming enough fiber. Consuming at least 25 grams per day in fruits, veggies, brown rice, whole grains, nuts. Most women in the US only consume about 12 grams of fiber per day. So you should be consuming enough fiber. One easy way to add fiber into your diet, for example, is adding like chia seeds. Really simple way, also adds healthy fats. The opposite end of that, diarrhea. Many women will have either one or the other. Adequately hydrating your body, again, choosing bland foods. This is called the BRAT diet: bananas, rice, applesauce, toast. Avoid foods that make diarrhea worse. So avoid greasy foods, spicy foods, beans, fried foods, and raw fruits and veggies can actually make it worse because it's tough to digest that fiber. Next is acid reflux / heartburn. So unfortunately, the hormone changes that you're going to have, they could potentially, or they do lower the esophageal muscles, which could potentially lead to more acid reflux or heartburn. Not everybody gets this, but you want to eat small, frequent meals and chew slowly and avoid acidic foods. So citrus, alcohol, which we should be avoiding, tomatoes, dairy, coffee, they all increase that acid, which can lead to heartburn. One thing to think about with tomatoes, this is similar to like marinara sauce, pizza sauce, things like that. Caffeine consumption. I know I mentioned something to limit earlier. So caffeine can cross the placenta and reach the fetus. So 2 cups of coffee per day is okay to have, but higher amounts may lead to miscarriage. Something to think about. You do want to consider the extra calories it could add. None of us should be counting calories or on a diet here, as I've said. But if you're getting the like cream and fun syrups all the time, it will add calories. Caffeine can also impact your sleeping. And many pregnant women have trouble sleeping, insomnia, just like being uncomfortable, restless leg syndrome, so many things going on. So don't consume caffeine like late in the afternoon, because that's going to impact your sleeping ability. Alcohol consumption. Alcohol crosses the placenta and the baby's immature liver cannot process it. This can lead to fetal alcohol syndrome. I say to abstain from alcohol. Some people will consume like one drink occasionally. I just say abstain, no safe level. This is a personal decision on everybody though. Next, we'll go into hydration. So hydration needs increase during pregnancy. Again, thinking of that like blood supply, we need to be drinking more water and your risk of dehydration is higher. Consume at least 8 glasses of water per day. I say closer to 10 when you're pregnant. And something to note is that tea, coffee, non-caloric seltzer waters, sugar-free electrolyte drinks, those all contribute towards those 8 to 10 glasses a day. So reminders, if you're not consuming enough, set goals for yourself. I'm going to drink 5 glasses today, and the next week I'm going to drink 8 glasses. So, slowly increasing it. You could also set a timer on your phone. So how to do your best nutritionally? We're already dealing with so much as pregnant women. You're dealing with changes in your body, physically, mentally, emotionally, hormone changes. You're planning for a baby. There's so many things going on. Eat small, frequent meals. Eat when you're hungry. Sneak in veggies when you can, especially if they're like ugh to you. So smoothies, stir fries, soups, putting them in like meatballs. Give yourself grace. You are growing a baby. So you are going through a lot. You're participating in this program. You're doing so much, so many good things for your body. So give yourself some grace. So in conclusion, a healthy, balanced diet is appropriate for the pregnant woman. You want to focus overall on variety and combine nutrition with physical activity to optimize your health and your baby's health. And this is where physical activity comes in. I know all of you are physically active. So you are doing the right thing by being physically active. You're increasing your strength, your energy, you're staying strong, you're helping your pelvic floor. You're doing so much. So you should be combining that with nutrition. So I hope you've taken some things away from this workshop. So free resource for everybody. So it is my snacking free resource. So healthy snacking during pregnancy. So I go over the top mistakes to avoid when snacking, the right combinations of foods to be eating. For example, instead of eating like one food by itself, you need to pair it with this other food item to really maximize your energy. I give a ton of snack ideas. I also give quick and easy convenient snack items that take no time to prep or prepare. The link to download is right here. And I really want to hone in on this. In this resource, I provide quick and easy convenient snack items that literally take no time to prep or prepare. I'm all about convenience. I know that we're all busy individuals, we're active individuals, we're go-getters. I know that a lot of the time you just need to grab something. And that is what this guide has for you, is those things that I want you to grab so you can nourish and fuel your body and your baby. So the link is right here. You can also, just a little easier, you can head to nourishedroots.com, which is right here, as you can see. Head to nourishedroots.com to grab that snack guide, and it will be right there on the front page. And you can get instant access. You don't need to like email me for it or anything like that. It is right there for you, and you'll get the access to all of the snacks instantly. But if you do have any questions, please email me at info@nourishedroots, spelled like the word routes.com. If like you're having trouble with the link or something for it, please email me and I will send it directly to you. Also follow me on Instagram. I provide a lot of recipes, nutrition tips during pregnancy, and so much more. I also have a blog and a ton of recipes that take no time and they're effortless to make on my website. So you can contact me right here. I did want to thank you all so much for participating in this workshop. I hope you learned quite a bit all about nutrition and pregnancy today. I wanted to thank you and to thank Dr. May for having me today. If you have any questions, do not hesitate to reach out. I'm here for all of you. Again, here is my email address, info@nourishedroots.com. Again, my name is Allison Tallman. I'm a registered dietitian and founder of Nourished Roots. And thank you again for participating today. I hope you have a good rest of your day.